Anyone who's getting involved in any kind of innovation, a startup, or a new product, trying to figure out whether or not you should license a patent or whether a patent has any value, or even whether just an idea that you've come up with has value, sooner or later you're going to run into the question, well, what's the market for that? And I know from my own experience early on in my career, I was like, well, I'm not really sure exactly how to answer that question. I know there's a lot of people who want this, but I don't know what market means. So tonight we're going to talk about what market means. And we're going to start with the value proposition, just because I really like the value proposition, you may have noticed. So in the value proposition, we start with customers and end with value, and that's what we're going to talk about tonight. Right? So the market is made up of customers, and the money that they pay is what makes the value, and that's how you measure markets. So really, there's these two criteria that we're looking at when we're asking what is a market. So it's how many customers are there, and if they bought the product or service, what would the amount of money that they spend collectively on that product or service be? Okay? So the word customer seems kind of simple. I mean, if I asked my daughter what a customer is, she would tell me it's somebody who goes to the cash register and pays for things. And that's true, but the word's used more broadly. So it's in the space that we're in, the innovation space, the entrepreneurial space, a customer is almost a generic term of art whose meaning is influenced by context. And from the value proposition side of things, when we talk about customer, we're really talking about stakeholder, or who are we trying to help or benefit or influence. Who are the folks that are involved in what's going on, right? So these are stakeholders are going to be those who are affected by the decision to use or not to use the product or service, and that's either direct or indirect. And we'll get into a little bit on that in a moment. If we're asked to describe the market for a product or service per se, typically we are talking about the folks who are coming up with cash or cash equivalent for the product or service. Stakeholders, a word you've heard before. It's a word that you hear a lot in this space. And definitely customers are stakeholders. But there's a whole lot more in the stakeholder list. And even though they may not be coming up with the cash for the product or service, they're very important when we think about what a market is, how a market's going to behave for a product and service, what a market will bear from a revenue perspective, how much people would pay for it. So we were talking about who's consuming the product. Now, who consumes it may be different from who buys it. For sure, that happens in my household a lot. But it's also who's going to have a product. They may buy the product and then they're going to sell the product. So let's say we're talking about a wholesaler, right? Might be buying a business-to-business product, and then they're going to turn around and turn out to consumers. Who's getting paid to sell the product? So you have a medical device and you're trying to figure out how to get this medical device out there, and is the sales force excited about selling that product? If you're going to go through distributors and they're selling different products, would they like your product more or less? There are going to be features about that product which are going to make it easier and attractive to sell or hard to sell. And if the people selling the product don't like it, you're not likely to sell much of it. That's going to greatly affect the size of your market. Who benefits from having the product around? So we'll talk about payers or insurance companies who may be paying for the product in total or partially subsidizing it. They may be benefiting from having the product around. You could be talking about public health decisions that are made. It's a good thing that these vaccines are available, even though the government doesn't buy the vaccines, and they may put regulatory and even economic policies in place to support the development of certain products. or in the way of certain products, who's threatened by the product. So if you bring this out, generally the competition is going to be threatened by the product, but there can be other categories of folks who may not like it. A whole industry may not like it and may try to stand in the way of a new innovation coming out, even though they may not be specific contributors for that product or service themselves. They may not be attracted to the disruption in their marketplace that it might create. And of course, regulators are critical, especially in our space where many of the products that we would be talking about are going to require regulatory approval. So stakeholders, we can make a list of who the stakeholders are. So the end user is definitely a stakeholder. They may or may not actually be somebody who's purchased the product. We have influencers and recommenders. So these are going to be folks who may have, generally are going to be described as not paying for the product, but are going to have a lot of say on whether or not the product is accepted by the market and how much the market embraces and expands to open for the product. We have decision makers and payers. Now, payers by definition are paying for at least part of the product. Decision makers may not be paying for it at all. So, for instance, if you're trying to take a medical device into a hospital, there's, let's say it's a new type of catheter or something that you would use as maybe a generic, broadly used product in the market in a hospital. Maybe that's a product that you're going to try to sell because it's going to be easier to use, or it's going to reduce the amount of time, or it's going to reduce the complication rate, or lower the chances of infection. You want the nurses to be using that, you want doctors to be using it, but that's not who's going to decide whether or not the doctors and nurses get to use it. It's going to be a panel, generally, right? It's going to be a committee at the hospital that's going to decide what products they want to buy. The hospital itself is actually going to be the group that pays for it, but the hospital may rely on a group of decision makers to make that decision as to whether we want to go with this product or not. And then we have the saboteur. As I mentioned, there are always going to be, someone's going to be threatened when you bring out a new product. It's generally going to be those who have an interest in the status quo. So competitors in the space, definitely. But as I mentioned, you can have industry. So if we look at what's going on in Washington, D.C. at any particular time, we have lobbyists on one side and the other arguing back and forth on decisions that can be made in Congress, which then affect, or in the White House, which affect what's going on at the FDA or the NIH or CMS, and a number of government bodies which are going to be influential on whether you can sell a product, whether you can get a product approved, whether the product will be purchased, whether it will be recommended, and whoever's arguing for is on your side, and whoever's arguing against might be in the way. And generally, their goal is to make sure that their side wins, however they have to make that happen. And sometimes that's by working back channels to get in the way. So another term that you'll probably run into is a stakeholder map, or a sort of an ecological description of the stakeholders. It allows us to identify who the stakeholders are so that we can analyze them, and we can discuss them, we can present them to others. So if we were going to investors and we were talking about what's going on in the marketplace, we might be talking about this. Some folks like to stratify stakeholders by their level of interest in a particular topic, or in their level of influence on that topic. So this is the kind of thing you get when you get a stakeholder map. It doesn't look like Google. It looks more like charts. Here you can see there's a bunch of stakeholders here, everything from the payer, the physician, the patients in the middle, families and friends or support groups. You'll also see tables. You can see all kinds of different forms of communicating content. In this case, I've given you an example of what one table would look like, and then a different approach to the same topic. So if we were thinking back about Exubera and inhaled insulin, so stakeholders here, we might have the patient, and the feature that's going to affect the patient is they get to not use needles, which we learned was not true. The benefit is going to be less painful. If we look at the physicians, we find that it's going to be easier to use, which is also not true. But the benefit of that was supposed to be better compliance. If we look at our sort of pros and cons table, better compliance would be the pro, and the con is it actually turns out to be harder to teach and requires extra training. The payers would like better outcomes that results from the better compliance, but the cons there were, of course, it was more expensive. And we can think about payers in the case of Exubera. You could be looking at payers as a group that also maybe constitutes saboteurs, right? They're actually making decisions that were running contrary and effectively torpedoing the product. There was plenty of holes in that product, but that was a significant one. So I suggest that when we looking at who's going to be the customer, what's the market, where are the critical stakeholders, that we follow the money, especially when we want to understand who the customer is. So we can be confused about who uses or recommends the use of a product. If we want to understand whether a product's going to be successful, let's say it's a new medical device like inhaled insulin, we can look at that and say, well, the patients need to like it and the doctors need to like it, and that's true, but it may be the case that neither one of them pays for it. And what needs the payor, right? So in the case of the UK, we had the National Health Service decided they didn't want to pay for it. So even if the patients and the physicians liked it, if the payer doesn't like it, it's not going to go. Now, the payer may think it's a good idea and the patients and physicians don't want to use it, in which case you have consumers and recommenders not in your camp, and that's a problem as well. But definitely you want to follow the money, and I'll give you an example of how perhaps counterintuitive that can appear, and that comes to corporate strategy. So startups typically have, almost every startup in this space is going to have two critical customers. Can you give me, what do we think the customers are for any particular startup in the life science space? What's that? Insurance companies. Maybe. Not all of the products that we were talking about developing, for instance, accuracy cytometers, didn't have anything to do with insurance companies. That was not. But I guarantee you, all of these companies will have the same two customers. So, investors, definitely one. Yep. And what goes along? What's the other one that goes along with investors? Any guesses? Well, the answer is the companies that buy the company away from the investors, right? And this is a concept that sometimes can be sort of difficult to put up front, but it's if we follow the money in startup companies, it really isn't about the product. I mean, ultimately, the company is successful or not successful, but they come up with a good product. But what you have, in order to get investment, you have to be attractive. The company has to be a product. It has to have its stock, its equity, its ownership of the company has to be attractive to investors. Now, why is it attractive? Because it's got a really cool product. Okay, that happens. But it can have a really cool product and not be attractive to investors for other reasons. We had a conversation with an investor yesterday who talked about some really cool products that wouldn't be interesting because of the dynamics of the marketplace and how much it costs to get that product to the market and what the likely return would be because of what the big companies are willing to pay for products in that space. Not good enough. So even though it could be a really great product that customers could love and doctors could love and regulators could love and health companies, hospitals might want to have, it still may not be something that's attractive to investors. And if it's not attractive to acquirers, it's definitely not going to be attractive to investors. Right? They are more focused on who's going to buy the company and give them money than they are on the product itself. Now, the product itself is going to decide the success or failure of that. But again, you can have a good product in a marketplace that doesn't want to acquire those products, in which case it's no longer interesting to investors. When we get into talking about investing in equity, I'll give you some more examples of why what the investor's behavior is tied to what's going on and whether or not you have a good product, but it can be influenced by things outside of that. And I run into a number of innovators who have very clever ideas and can envision a change in the marketplace, and they can't understand why they can't have any success with investors. And a lot of it often comes down to this concept of, is this really going to be attractive to investors? Forget the product. Is the investment opportunity going to fit with what they need to make that work? Okay, so a new drug has to be attractive to patients to be a hit, but the startup has to be able to sell both the vision, the team, the technology, the marketplace, the potential acquirers to investors and acquirers in order to succeed. So let's go through some examples of customers, paying customers. And so let's assume that we're looking at a medical device company. And the medical device company is going to be selling a dental tool. Who's the customer for the dental tool? Generally, those products are being purchased by dentists. Right? They're being purchased in individual dental practices. So you would go and you'd need salespeople to go to the dental practice and make the argument, you really should buy this type of drill instead of that type of drill. If we were talking about a surgical tool, depends on where the surgical tool is being used, but often the purchaser of the surgical tool is going to be the hospital, not the surgeon. Right? So the dental tool is going to be purchased by the dentist, the surgical tool is going to be purchased by the hospital. Right? And in order to figure out what your market is and who's going to buy it and why they're going to buy it and the way they behave and how to calculate how much money they have and would put into the market, you need to understand the difference between those so you can understand who your paying customer is. So another example around drugs. So if we're talking about an over-the-counter medicine or perhaps a supplement or something that's being paid for out of pocket, the group that you need to get to come up with the money is going to be the end user, the consumer, the patient. Right? If we're talking about a prescription medication, almost always we're talking about a payer having to be convinced to pay for the product. Now, the patient is typically going to have an out-of-pocket cost for most of those things, and we may try to help the patient along so that price doesn't get in the way by doing some sort of supplementing of what the copay is. But the payer has to be convinced that they want to pay for it, otherwise it's not going anywhere. And the last one here is let's talk about a startup company. So a startup company will have as a product a patent right. So they've invented a product, and the product may be for sale, or the product might be in clinical trials, and a big company, and so if we think about Nektar, who was inventing the inhaled insulin, Pfizer, the big company, Pfizer is looking for new products. Nektar to them was a vendor of innovation, and they were buying rights to the innovation. And the way they buy those rights typically is going to look like a license for patent, the ability to use a patent. To the investors, they were looking at ownership in the company, stock in the company. So whether a company is a private company and you have investors buying stock in a direct transaction, or the company has gone through an IPO and the investors are purchasing it on an open market, they're buying part of the company. So the investors are going to be excited that the product is innovative and that customers are excited about it and that hospitals want to use it, those sorts of things. But ultimately, they're going to be looking at what's going on with the stock. And I don't know if you've noticed, but what happens on the stock market sometimes has nothing to do with whether or not the company makes a good product. Doesn't seem to make any difference. Investors are influenced. Market behavior is influenced by a number of things other than just the product that a company sells. Okay? So, what is a market? A market can be measured and described, defined in many different ways. So the way that comes to mind first to me and for many is going to be how much money is in the sale of products into this particular world. And that's generally measured by total annual revenue. So total annual revenue, we're not talking about how much profit you could make off of a product. We're just talking about the sales price times the number of units that were sold. Okay? So that's what we call a top line number. Right? And we're going to subtract out of that how much it costs to make it, how much it costs to sell it, how much it costs to run the company. And there's a whole bunch of other things that result in a bottom line number of profit. But when we describe markets, we're typically talking about the top line. We can also be talking about the number of units that are sold in a market, and we can be talking about both of them, and there's a relationship because based on the number of units times the average selling price is how you get to what the total revenue would be available. But we could also be talking about, when we say the word market, depending on the context in which we're using that word, we might instead be talking not about the product or the money, but about the customers who are going to buy the product and give us the money. Right? So we're going to go through a little bit of each one of those things. But if you hear the word market and you hear it in a slightly different context, 3 different times you hear it, that's okay. That's the way it's supposed to work. Okay, so I'm going to get a little deeper into jargon. I'm actually going to throw some acronyms at you. And I apologize, I generally don't like to do this, but if you do anything in this space, you're going to typically be asked about the market, and people are going to say, well, what's your TAM and what's your SAM? And you might go, I've never met them. And that's not the best answer. So TAM and SAM stand for, actually, I would say the marketplace, the sort of field that we're in can't even totally agree on what TAM and SAM stand for, but they agree that TAM and SAM are numbers that they can can understand the numbers. So TAM is a total addressable market, so it's the broad market for similar types of products. So imagine we have a company that's going to make flip-flops. Okay, so like we're going to be the Crocs of flip-flops, right? That's what we're going to do. So we're going into a broad market of footwear. Okay? And then there's SAM. The S can stand for different things. The A can stand for different things. M always stands for market. But that's going to be a portion of the TAM. That's a subset of products. So flip-flops would be in the sandal category. And by definition, the SAM is smaller than the TAM. I tell you that so that you know how to answer the question when somebody says, what's your SAM and what's your TAM? And you can say, this is what it is. I hope to show you in a few minutes that maybe that's not all that useful. But it is lingua franca in the space. So then there's target market. And that's generally talking about a specific product type, or often it can mean the group of consumers that are interested in that. So our target market is going to be type 2 diabetics who are on insulin therapy. I've just defined a target market for Exubera, or for anybody else who's in the insulin market. And I haven't defined it in numbers. I haven't defined it in numbers of dollars or numbers of patients, but everyone would understand that that was my target market. So it can be a description of the customers, or it can be a description of the product type, and you can put a number on what the size of that should be. So this is a little bit like E equals MC squared, so the number of customers and the description of the customers has a relationship to the number of dollars in the marketplace, and when we talk about a target market, we could be talking about one side of the equation or the other. Then we have the lead product. So this is, by definition, the first product you expect to be able to reach the market with. And it's going to be the primary focus of the company in the early stages. This is what you're mostly going to be trying to do, is get that product out the market. That may not be the last product you come up with. It may not be the best product you come up with, but it is going to be the market you're going to enter first and the way you're going to enter that market. And you're going to succeed or fail often on what the lead product does. You don't generally get a chance for a second product when the first product is a flop. So, as I alluded to, there's this idea of what's the total market, what segment of the market you're in, is a little bit slippery. So if we look at the example that I gave you, so we said, okay, if I need to present this to somebody who's going to give me a grant, or an investors who are going to invest in my company, or I'm trying to, and I understand I'm in the footwear space, and I'm in the segment of that market that's sandals, and then my lead product into the sandal market is going to be this super flip-flop. But we could also be talking about we're in the women's clothing and apparel and footwear, and we're in the shoes portion of that, and our lead product is a super flip-flop, right? So we have the same product, but we've described it, with a different TAM and a different SAM. You can think about this. If you go to a department store and you want to find sandals, how do you find the sandals? Do you go to the shoe department? Well, not at Macy's. You'd have to figure out if you're a men's shoes or women's shoes, right? So that's how you would find there. Right? If you go to somewhere else, you might, I think if you go to Kohl's, you go to the shoes department. That's where they have all the shoes, no matter what gender you are. Right? So we could also be talking about luxury wear, because we're going to be talking about beach apparel, resort clothing. And this is going to be in the women's footwear section of that, and they're going to be super flip-flops, because they're really super flip-flops, right? They're very expensive flip-flops. We could also be talking about sporting goods. Our market is in the sporting goods space, and we're going to be in the swimwear section of whatever store you're in, and that's where you'd find your flip-flops. So I hope you can see from this that there's no universal rule for segmenting a market. There are going to be conventions that be applied, and once you get into a market space, you may say, well, most people tend to, they look at these segments, and if I want to be able to communicate with them in a way that they understand, I'm going to have to use those segments. You may be looking at its context. People may say one way or the other way on a segment, but the competition that I'm going to displace considers themselves to be in this segment, so that's the segment I'm going to talk about when I talk about what my market is. You can use some logic. Sometimes it's available data. I may not know anything about the footwear market or the women's apparel, luxury apparel, but I know a lot about what the sporting goods market is, so I'm going to say that's what my market is, because I found a number for that market, and so I can describe that market. Right? That's a $90 billion market, so I can put it in my business plan, $90 billion. That was the only number I could find, so that's what I'm going to do. That's okay too. All right, so markets change. Another thing that we're going to use when we're describing what a market is we're going to talk about, generally, a market should be growing. Most markets that aren't growing are going to be markets that investors won't go into. So compounded annual growth rate is that you'll see CAGR. That's hopefully the last acronym I'm going to use. And you'll see what it's has been measured. So what has it been since 2012 through 2016, and what is it projected to be 2017 through 2022? Right? These are the sorts of things that you'll see. And then there's the idea of disrupting and expanding a market. So remember in the Accuray cytometer example I gave you, we were planning to bring cytometers to the great non-cytometer using masses. Right? So when we went in and talked to investors, we said, well, this is what the cytometry market is now, but we're going to sell cytometers for less and make more. It's actually a bigger market, even though we're going to be selling it for a quarter of the price. Right? Our top line revenue number for that market is going to get bigger. We're going to have more customers, more than 4 times the customers, and therefore have a bigger market. But it's very difficult to do the prediction on that. It's even harder to make the argument to investors that that's going to happen. I mean, you can say that it's going to happen, and they might believe that it's going to happen, but the numbers that you put on that are difficult to come up with, because you're describing something that's never happened. I mean, sure, markets are disrupted and they expand, but the particular market you're talking about has never been disrupted and expanded by your product, so nobody really knows what's going to happen. So you have to make a good case, and we're going to talk about how you make that case, or the case for any market. Okay. In any particular segment, the competitors in that segment are going to share it. Not because they want to, not because they're nice, but that's the way it works. We have, the metaphor here is the pie, and everyone has a slice of the pie. And if you're going to enter a marketplace, you're going to say, well, our share of that market is going to be this. Now, this is important here. When you talk about what your market is, you're not talking about what percentage of the market you think you can get. That is a number, and that has an acronym, and that's useful. But when you say our market, the market for flip-flops is not the market, is not the amount of flip-flops you could sell, and how many flip-flops you could sell in a space that had 100 other companies selling flip-flops. It's all flip-flops. What are they being bought for? What's the total number of dollars spent on flip-flops? That's the market that you're in. Then you're going to be talking about, we expect to be able to get 1% of the flip-flop market, 50% of the flip-flop market. We're going to have a monopoly, a complete total monopoly on flip-flops. That would be 100% of the market. Okay? When you're thinking about what a business plan should look like, or you're thinking about your financials, your percentage of the market starts out at 0, and it does not go from 0 to 10 in year 1. It's difficult to get into a marketplace, even if you have the world's most awesome product. There are a number of reasons why it takes time to build a market share, but it is going to take time to build a market share. Right? One of the things that investors hear a lot is, well, if we only had 1% of this market, we would do that. And investors may look at it and say, if you get 1% of that market, terrific. You've been very successful. Good luck on trying to do that. So trying to get even a small portion of a market is a big challenge. One can't look at it and say, well, 1%, that's easy. I can do 1% of my lung function like that. That was easy. So clearly my product is going to be able to get 1% of the marketplace. Not so much. So your slice of the pie, when people want to talk about what's your market, I want to reiterate this because this is the kind of thing that you get asked. To say, well, what's your market? What's the market for this product? Remember, this is what we started out with. So it's going to be, we want to know how many customers are in your marketplace and what's the total revenue if all of those customers bought only your product. That's what we're looking for when we talk about what our market is, what our target market is. Okay. So how are markets measured? So you could take a guess at this, right? It's going to be around money and counts of products sold and number of customers. So let's look at this a little more. We're going to have 2 types of analyses we can use. We can use a bottom-up, right, which is we may have a good estimate of the number of customers and what we expect their behavior to be. And then we're going to multiply that by the average selling price. Oops, there we go. Another acronym, sorry. And from that, we'll calculate the market size. So if you want to talk about disrupting a marketplace, you're not going to be able to go and say, well, here, we're going to disrupt it and expand the market. You can't take the number that's published somewhere that says, well, this is a $100 billion market. Oh, well, we're going to get 30% of that. That's what's, and we could do that. And so therefore, it's a 30 billion, our segment would be 30 billion. You can't do that because it doesn't exist. So instead, you have to look and say, well, so in the flow cytometer case, how many people, how many scientists are there, how many labs are there that are doing a particular technique that could be used on a flow cytometer, right? So bead-based immunofluorescence. We could do that on our flow cytometer. So that becomes part of our market. So we're going to take those and we're going to include them with all of the folks that we can calculate who are in the immunology space. And we're going to start calculating how many labs there are. Not researchers, because not every researcher is going to have their own flow cytometer. We're going to calculate how many labs, because the lab is the purchasing unit, right? So our paying customer in that case is the lab. So understanding who your paying customer is very important to being able to do that calculation, because you've got to know who it is you're trying to do what's the multiplier there. Top-down analysis is the other way around. We have good numbers on what, I don't know how many people buy flip-flops every year. I have no idea. Right? But if I could find a market research report that says, you know, the market for sandals is $100 billion, of which approximately 19% is flip-flops, and I'd be, oh, it's a $19 billion market. Great. Right? How many customers are in there? I don't know. I really don't know. And nobody's published those numbers. I can't guess. Okay? So where do we find the data? Because this is the other thing, is you're going to have to describe your market. So how are you going to do that? I mean, where are you going to get this information? I would say Google. I'm going to show you an example of, I just did a little Googling for fun. But you can be looking at, so we went through and looked at what are the NIH grants that were in a particular topic. Every one of those grants we could figure is a laboratory. We might even be able to say something like 1.5 laboratories per grant. We could do some calculator, and then we could conclude how many NIH-funded laboratories are working on that project. That would be one way to do it, right? So we have to get sneaky here. We have to be detectives and try to come up with the numbers. Top-down analysis, sometimes you can just go look up a market research report. You may have to pay for it. If you were here at the university and you were a student, you might have access to one of the libraries that might have the market research report. Sometimes the numbers are published. Trade associations will publish numbers. You want to know how many horses ran around a track? You can find that out just by looking. The American Jockey Club has that. Right? They're happy to tell you that. It's part of their lobbying effort. Okay? So these approaches are complementary. I'll show you an example where we can do numbers that actually conflict with each other. Don't be terrified of that, because that happens a lot. Generally, even when you're looking at top-down numbers, there are reports that are coming that are being collected by someone who's doing market research, and they're trying to find all the data they can, and then they're giving you a number that's based on what they think the number is. But they haven't actually collected everyone's receipt from every purchase and added them up. So it's not an absolute number. It is not something that is in fact true necessarily. And in fact, sometimes things in our market research reports aren't true. And you have to double check. Do we really think the market is that size? You may have to go around and ask. Okay, so I'm going to finish here with an example. So I've invented a company, PetHealth.com. Turns out there isn't a PetHealth.com. In fact, we can buy that. That's available. I made my own logo. Actually, I didn't. I copied it from something. So this is our company, and we're going to be pitching this to investors. I was going to call it Pets.com, which, for those of you who may remember, was actually a startup company. In the first boom, they blew up. They had the sock puppet commercial at the Super Bowl. But I decided not to go with a Titanic. Okay, so this will look familiar to those of you who are in the workshop. I'm going to go through the value proposition for PetHealth.com, that puppies are whining, pets are hungry, and they're hungry because it's such a pain in the butt to get the pet food. The owners are out of food because they forgot to stop at the store, and it's a nuisance. So we're going to try and solve that. And we're going to try and solve that in a universe where Amazon does not exist. Okay, so just suspend disbelief for a moment. Okay, so everybody's got the value proposition there, right? So I can even talk about what my competitive position is. The advantages here are my competition are calendar reminders and to-do lists. There are also retail organizations that are selling pet food now. I have advantages over them. Most consumers are purchasing their dry dog food at a local retail store, like the grocery store. They may be actually they may prefer something they can only get at a pet store, specialty pet store. And in either case, it requires an extra trip. And the bags weigh a lot of, they're like 50-pound bags, and that's the most economical, but they're really heavy and bulky, and I don't want to have to drive out to the pet store to get the stupid bag and put it in the back of the car. So it's just going to show up at the front porch. This is going to be fabulous. So my stakeholder summary are going to be the owners. The owners are also going to be my paying customers, right? And the feature here is home delivery, and what's the benefit? It simplifies their shopping and it saves them time. They also don't have to listen to the puppies whine. The puppies are also stakeholders in this. They are not paying customers. They get a regular supply of puppy chow and full bellies, and they're very happy. And the family is also a stakeholder here. They don't even see a feature. The kids don't even know. They just whatever. The dogs are happy, and they have lots of energy, and the children and the puppies can play. And isn't that terrific? There could be more stakeholders. I'm sure we could come up with some additional ones here. For example, UPS might be a stakeholder, right? They're delivering the puppy chow. They may like the fact they're getting the extra business, or they may not like the fact that their trucks are being filled up by 50-pound bags of food. We may have to figure out how to get food properly packaged so that it is economical to use through UPS, or maybe we'll find another delivery. Maybe we'll go through the Postal Service, and maybe they really love 36 pounds and they don't like anything over 36 pounds, so we're going to have the special 36-pound bag of food, which we've invented. Because it works really well and we can get a rate on shipping. Right? So that's an example of a stakeholder that you might not think about just when thinking about who the paying customer is. So we have a TAM and a SAM. So you guys tell me, what's our TAM? Take a guess at what the TAM would be for pethealth.com. Any ideas? Well, wow, lots of ideas. Okay. So what did you say? Dog food. Okay. Pet supplies. All pet food. Yep, I would agree with all those. So it could be pet supplies, could be pet food, could be grocery stores and groceries. We could be talking about pet supplies sold on the internet. We might have a number for that, right? It's a $20 billion market, and we're going to make it twice as big, right? So that could be part of it. There's lots of other things we could have there. In the SAM, we could be having, say if we said it was pet supplies, we could say it was pet food was our SAM. We could say it was dog food was our SAM, right? There's other things we could come up with there. So I've Googled this more than once. I just Googled it the other day and got some more numbers. So if you Google pet food market, or a few other terms that you can put into Google, you'll find all kinds of statistics, right? So we can find statistics that I put into this chart form here, just so we can, or table form. So what are they surveyed owners of pets, and they asked, what do you spend per week or per month or per year on these different things, like going to the vet or buying food or, that sort of stuff. Treats. So we have a number of, this is the out-of-pocket, this is what people are actually paying per year based on a survey, right? So then we have the industry actually tells you what the size of their industry is. You can get the total U.S. expenditures on pets, all pets, right? So we're talking everything from lizards to horses, and I don't know, things that I don't even know what they are. So, and it turns out that that's a big number. It doesn't say anything about food per se, but then we can look at U.S. expenditures in 2015 on pet supplies with a line item of food, right? So now we know that according to the industry, it's $23 billion a year are spent on food. In fact, we can look at and we can say to our investors, this is the largest segment of the pet expenditure market, which is good. You always want to be going after big segments, right? So then here's another set of statistics that you can get off the internet and patiently put into a table so that you can present it. You can get how many households own a dog, at least one dog, right? How many pets do they own? How many, and then you can calculate this if you're up late and have nothing to do. You can calculate how many dogs per household of households that have a dog, right? So it's just interesting. So if you have a cat, you're more likely to have more cats than if you have a dog. Okay? I don't know why that is valuable, but, and if you have fish, you're likely to have a lot of fish. But that makes sense, right? Most fish owners don't have a goldfish in a bowl. So we can get a sense of how many households are, and the household is really the purchasing unit, right? So there's an adult in the household, maybe multiple adults who are responsible for making sure there's enough food around. They may both decide what kind of food we want to buy. So it's really the number of households, not the number of people who have a dog. Because one dog may be held by multiple people in the household. And there's more. We can look at food sales broken down by wet and dry and species. Okay? This is all available on the internet. Now, it can be harder to find medical device statistics, but not that much harder. A lot of this stuff is published. You can go to Wikipedia and get a lot of numbers out of Wikipedia. What's top-selling pharmaceuticals? You can find the Wikipedia page on it. And then you can get the reference and find out those numbers are actually real and published. Important to do on Wikipedia. So we can look at this and say, well, if we were in the dry dog food market, that's a $9.2 billion market. So if we said that that was our SAM or was our target market, the number we're looking at is $9.2 billion. Okay. So the numbers I look at here that are immediately applicable to my executive summary are going to be the ones that I've highlighted there. Right? So there's some other numbers that are going to be useful there, and I'll show you how we can use them in a moment. But the ones that I can pull right out of the tables and put into a business plan is $2.3 billion are spent in the U.S. on pet food. Of that, $9.2 billion are spent on dry dog food. That's our lead product, is dry dog food. So people want to know what my market is, I'm giving them the answer. So here we go. Market for pet supplies, $37 billion. Okay, that includes both. So if I go back, right? If we add these together, that's how we get to 37. We're cutting out vet care, live purchases, and services. Right? So people who buy things for their pets spend $37 billion. Okay? So we can say that pet supplies is our TAM, and we can say the market for cat and dog food is our SAM. Right? And again, we're getting that by adding those numbers up. We're also, notice that we have in here, we have the growth rate. I didn't have that in the table, but I got it off the internet. I had to Google more than once to get that number, but it's there. And then we can talk about our target market. And our target market, we're going to describe that as the number of households that own dogs. And I got that out of the other table, right? Number that hold cats, and their average expenditure per year on food. Right? That came from, oops, sorry. Right? So we got average expenditures up here. We've got households down here. I did some manipulation there of the numbers so that I could put them in here. So our lead product is going to be a branded dry dog food. So we're not going to sell other people's dog food. Well, somebody's going to make the dog food for us. We're going to put it in a bag. We may not even put it in the bag, but we're going to definitely hire the graphic artist who's going to put the label on the bag. And the sales for that particular product was $9.2 billion. Okay. So we also have our forward-looking market strategy. Our follow-on products are going to be dry cat food and wet food for cats and wet food for dogs. more popular among cats than dogs. We're going to expand then into other products, and we're going to expand into treats, vitamins, grooming aids, toys, and that's $14.3 billion, approximately. And long term, we're going to expand into food and supplies for other pets, and we're going to work with small household pets, of which we have a lineup of the usual suspects, including ferrets and rats. Okay. So I threw out a number there that doesn't come from any of those tables. I'm going to show you how I got that number. I've had to calculate a lot of market numbers in business plans that I've worked on, and that's because we don't usually have such a supply of freely available numbers. We often only have one or two, and we have to try to infer what's going on there. So we're doing some deduction, and here's how I got $14.3 billion. I took these numbers here and these numbers here, and then I did some sleight of hand. So here's how I did it. I looked at food and treats, vitamins, groomers, groomer aid, toys. Now, remember I said we were going to expand out of food into these other things, but I needed the number for food in order to come up with this. Okay? Then I also looked at these numbers, which I already knew about, actually what the total was on food sales. And here's what I did. I took this number and I calculated what percentage of purchases this number was. So in surveys, owners of dogs and cats said they spent about 18.6% of their expenditures on food for their pets. And I looked at the total amount that they spent on food, and I said, well, I can infer what the total market would be based on that. Okay, so I solved for X, and this comes out to a total market for cat and dog of $96.7 billion. Now, you may notice that that number is actually different than the number that the industry said was spent on all pets for all things, not just cats and dogs, and that was about, I think, $60 billion. It's okay, the numbers don't always add up. This is also based on a survey, right? So that's not their receipts, that's their best guess when asked. They may think that they spend more money on toys because they have to buy these dang things and they're really expensive, when really what they're spending a lot of their money on is food. I don't know. There's lots of reasons why a survey might have different numbers. So then what I did is I said, okay, we've got 18.6 there, and then I took these numbers, I added them up, and I got to 14.8. And then what I did was I took that number and took 14.8% of it, and that comes out to 14.3 billion. And I said that's the size of the market for toys. Now, that may not be true. I don't really know what people spend on toys and treats and vitamins and grooming aids. But from the numbers that are available to me, and from the numbers that might be available to anyone in the marketplace, that's the best number we can come up with. Okay? It's okay to come up with numbers in the way that I've done it here. It's also imperative that you explain to people how you got that number. All right, so like anything else, if you're going to reference a fact, you're going to have to say where that fact came from. And in this case, it's going to come from a calculation. We would normally in a business plan put in our, we'd have an assumptions page, right? We're assuming that this is true and we're assuming that that's true. And here's how we got this number, and this is why we're assuming it's true. So I will conclude with the following. Just some take-home thoughts on understanding what the marketplace is and how to communicate the marketplace. And when somebody says, well, what's the market for whatever? Things that are very important to do is we're going to list our assumptions. We're going to talk, be clear about what our logic is. We're going to be transparent on our references. It's okay if that number's not real. It's not okay if you are presenting a number as real when this is the best guess. This is the best science can do. As far as we know, it's a $14 billion market. And investors can look at that and say, well, you probably overestimated because people are overestimating how much they spend on toys, which means it's probably more like an $8 billion market. Okay, fine. But if they say, what size is your market? And you say, well, I don't know, you're in trouble because you don't know much about your market. That's the conclusion. So you got to have numbers. So we're going to do research, even if it's Googling at night when everybody in the house has gone to sleep because you love it. You're going to be resolving your segments, what segments those are and which ones you're going to choose to explain the logic of how you're going to fit into the marketplace. It's going to depend on what your product is, what the future you see for your company is. Are you going to be expanding into all pet food, or are you going to expand into all groceries bought on the internet? Well, that might affect which you choose as your TAM, right? You're going to imagine the future markets. You're going to look at what the growth is expected in those marketplaces. What changes could you expect by bringing your product or service into the marketplace? And you're going to have to be creative in this process because not all of the numbers are going to be there. Sooner or later, you're going to need a number that's not available. Even with all of the pet food statistics that are available, I couldn't find all of the numbers I wanted. Things that we're definitely not going to do is we are not going to exaggerate. It will not do you any good. Sooner or later, somebody's going to figure out you're exaggerating, and then you're going to lose your credibility. And when you lost your credibility, the rest of your business plan doesn't matter. We're not going to dwell on irrelevant metrics. So I see this a lot. This is very common. What's the market for this? Well, the market for prescription drugs in the United States is this. I don't care. It's irrelevant. That number doesn't mean anything to me at all, right? If you have a drug that you're inventing, the size of all drugs sold in the United, you can make the case that that's a TAM. It's just a number that doesn't mean anything, and when an investor sees it, they're going to be like, whatever. This is a silly number. This is an immature number. It's not meaningful. It's not useful. We're not really describing anything about the marketplace or in any meaningful way. And if you think you're going to get 1% of all the prescriptions sold, you don't really have much logic behind your understanding of the marketplace or where your numbers are coming from, because you're not taking a percentage of the total prescription market. You're going to be taking a percentage of the total diabetes prescription market. Now that you may be able to pull off. Even better yet, you're going to be taking a percentage of the insulin market, right? That's really a number that we can start to talk about. I'm going to be able to take a percentage of that. And here's why this segment exists and why I'm going to be able to take it out. So if you're putting out a lot of numbers because you could find them when you were Googling late night, and those were the numbers that you could find, and you couldn't find the numbers you wanted, they're not really helping you. We're not going to be lumping mixed groups together, so all prescription drugs, we're not really competing against all prescription drugs. We're going to be competing in a particular space. Certain types of customers, patients, could be using our product. That's the market space we're going to be competing in. You also can't get hung up on getting it exactly right. So it's better to have an answer, what's the size of that market, and you say, well, it's $14.3 billion, we think. Then the answer, we don't know. Okay? So don't stop and do nothing because you can't find the answer. This is true for everything in the entrepreneurial and innovation space. You just have to go forward. Sometimes you're going to hit roadblocks. Do the best you can. Come up with a number that you can, or even come up with why you think the market is large. I don't know what the number is, but it's got to be north of this billion. And the reason for that is because clearly people spend more on this than they spend on that. Even if it's a relative description of the market, that's helpful. Okay, so that's the last slide I'm going to present. If you have any questions about my new pet company, feel free to ask. If you have any other questions, feel free to ask. Yes?
I have a question about your forward-looking market survey.
Uh-huh.
So you started by saying we're going to do this internet pet food delivery, and then you had this sort of like diversified vision that we're going to get into toys and we're going to get into pet food and all these other things. And so the question is breadth versus depth. And so is it, you were describing we're starting with one slice of the pie and then we're going to take over like all of like pet mania. And would it be wrong to just say no, we're just going to stick with dog food and we're going to do dog food really well and we're not going to do anything else?
Right. So the question is if we have a forward-looking market strategy, does it have to include expansion to other product areas? The answer is no, it doesn't. I don't know what the market for pet mania is, but I bet it's pretty large. So this would be common for a business plan, is to say we're going to have a lead product and then we're going to have products that follow on behind that, that we're not going to just do a product. Even if you're only going to end up doing one product in your company's lifespan, you generally have a plan for how you could go beyond that. But you don't need to have one. Investors are generally looking for, how does this plan grow? We're going to be succeeding. We've put money into creating a company. We've put money into developing a team. We've put money into developing a market and a brand. Now that you've done all those things, terrific, make money off that product. But what are you going to do with all these assets that you've created? You're going to monetize them by doing more with them. Right? We have this team that's getting this drug into clinical trials, and they're experts in the area of autoimmune disease. What are we going to do with them? Well, we're not going to have them sit on their hands. We're going to have them come up with other products in the autoimmune disease space.
Would it be fair to say that you're not really building or disseminating a product, you're really building a brand?
Sometimes. Sometimes building the brand is a big portion of the value. Other times it really doesn't matter. A drug company definitely has brands. It's important to build their brand, but a startup drug company may be more about the pipeline of drugs that they have. The name of the company is really irrelevant. The team that they have running it and the compounds that they have in it, we judge to be good. These compounds look like at least one of them is going to be very valuable, and we believe the team can get the value out of that. That may be the most important thing out of it. So it's not necessarily the case that when you're starting a company, to answer your question, that you're focused on building a brand or that's really what you're doing. It varies. In this particular case, where we're talking about a direct-to-consumer retail, brand is very powerful. In other cases, brand is less important. But it's typical that we're going to be taking investor dollars and creating value with that, and then we're going to be able to use those assets to create even more value. Again, it may not actually come to fruition. You may make that product and Big Pharma comes along and buys it out. But often Big Pharma will come along and buy it out, and the price that they pay is going to include a kicker for those other future products that you had in your pipeline. Investors like that because they know they're going to get more money back. And remember, that's their business model, is to put money in and get money back. So that's useful for them. They want to look at a business plan that looks attractive to the acquirer in the end. Yeah?
So it seems to me what really matters is the target market. And depends on the way you segment the market, you can have different number for TAM, for SAM. So why do we need it at all?
Right. So the question is, if the most important number is the target market, why do we bother with TAM and SAM? In part because everybody else wants to deal with TAM and SAM. That's a good reason to do it. Because the folks that you may be talking to maybe expect that. But there's also, it's a piece of information that's useful. If there's a bajillion dollars floating around in this marketplace, right? That's an indication of that this is something that's highly valuable. And even if we're only dealing with this segment of it, people are spending a lot of money in this area. They spend a lot of money on apparel. Okay? That means that the marketplace has deemed this to be valuable. They want to spend dollars on it. So even though our segment may only be this, it's part of a market that's buoyed by a lot. And we may be able to be moving people off of, I'm going to spend my dollars instead of on a new shirt on my new sandals. And we may be able to convince them that, in fact, buying a fashionable watch is more important than buying a fashionable jacket. Then it's important to understand how much money is flooding into this marketplace. How much could you siphon off, right? If you're in a marketplace that basically that's it and nobody does anything but buy sandals. They don't buy any other clothing, which would be weird. But if that's what they did, then you'd also be looking at it saying, well, there's not a whole lot of wiggle room, right? If there's anything that comes along, like sandals are replaced by shoes, you're out of luck. Does that help answer your question? Yes?
I have a curious question about your example, the pethouse.com.
Yes.
Because I know based on the marketing, that they sell the dog food based on the age. The young age, like 1 year old, is a child, and
Yeah.
about like over 7 years old, like a senior.
Uh-huh.
And the plus, the dog food, they have, usually they have different flavor.
Yep.
So when you calculate that, is you can speak about these lots of different factors, like because, dog probably will not eat a food from the very young age to 10 years old. These lots of different variations.
Sure.
You calculate one.
Right. So the question is, hey, there's lots of different kinds of dog food. I just said that I was going to sell a dry dog food. What about the fact that there's puppy chow and late adult chow and chicken flavor and all these other things? Are these segments in the marketplace? They might be. Again, this is where you kind of have to use your best judgment about it. And in fact, at pethealth.com, we would be selling several brands branded. We would definitely have a puppy chow. It's true that dogs will eat any of that stuff. It just makes older dogs fatter because it has more fat in it, right? I mean, that's fine. I wouldn't, in this particular case, I wouldn't call those segments of the market. They're all dry dog food. They're just a way of getting the consumer to buy mine over buying somebody else's because it feels good to them that that particular product is the right fit. So if nobody in the marketplace who sold dry dog food had puppy chow and I came out with puppy chow because I invented food for puppies, which is really just kind of a reformulation, people would flock to buy a segment of that market, those who own puppies, right? So we can look at it and say the average, there we might be talking about the average age of a dog is this, and so 1 out of 7 dogs is going to be in its first year, and therefore the market for puppy chow is 1 out of 7. We could be talking about that as our target market. I just did those calculations right there. That's how easy it is. Maybe that is a segment of the market, and it's definitely the case if I were doing an invention of puppy chow and I was going to disrupt the market by bringing out a puppy-branded chow, that would be important to talk about that segment. For a sort of staid market, maybe that's not that important. The question you asked, though, is I can't give you a hard and fast rule. I can give you examples of why I would do it one way or the other. But they're all going to be influenced by what my product is, what the marketplace is, what the competition in the marketplace is, what the behavior of the customers are likely to be. Those determine whether or not I have meaningful segments or not. And I have to think through, as an innovator, I have to think through that.